hypertrophic obstructive cardiomyopathy and hypertrophic non-obstructive cardiomyopathy. So when we put echo probe on a patient and when we see the left ventricle is hypertrophic, the first thing in our mind is whether this hypertrophic is concentric hypertrophic or non-concentric or asymmetrical hypertrophy. So when hypertrophy is concentric, so the commonest cause of concentric hypertrophy, left ventricular hypertrophy, is hypertension. Second is chronic renal failure and the patients on dialysis patient, and also the patients who have aortic stenosis or left ventricular outflow tract obstructions. So these are the reasons for concentric left ventricular hypertrophy. But when hypertrophy is symmetrical, we should keep in mind hypertrophic cardiomyopathy. So hypertrophic cardiomyopathy, for diagnosis of hypertrophic cardiomyopathy, the first important diagnostic criteria is ratio of intraventricular septum to the posterior wall in the parasternal long axis. If its ratio of intraventricular septum and posterior wall in parasternal long axis is more than 1.3, it's suggestive of hypertrophic cardiomyopathy. And hypertrophic obstructive cardiomyopathy, when hypertrophic cardiomyopathy is associated with systolic anterior motion of mitral valve. So when hypertrophic cardiomyopathy is associated with SAM, we can see the gradient, the left ventricular outflow tract obstructive gradient in the pulse continuous wave Doppler. So it is very easy to diagnose, but when we not find any obstruction, we have to perform valsalva maneuver to augment that gradient or to see the gradient if there is a left ventricular outflow tract obstruction or not. So friends, please like and subscribe.